Afya power. Solidarity.
Forever.
My name is Washira Peterson. I am the National Chair for Kenya Union of Clinic Officers. I am also the Chair for Health Union Caucus that brings together the unions that represent. We had an opportunity to visit the outpatient and the inpatient in the Nakuru level 5 hospital known as the PGH. And I can tell you the situation there is chaotic because the clinic officers who are there previously have been terminated, and those who were being engaged in a very funny manner, they even refused to report. The things we have found here are really worrying, and I must say that as a country we must be serious about what we want to do with our health and the direction we want to take in terms of healthcare. The people standing behind me, employed or engaged since 2019 on short-term contracts under 6 months, which is against the law, for 4 years. They have never been given any gratuity. Nobody can be allowed to go and further their education. They did not qualify for any pension. There is no way of that person being able to develop themselves and being engaged like casual workers. And we are talking about the health sector. And this cuts across all the cadres from the doctor to the mortician. And the most unfortunate being that the governor, Nakuru County, Governor Kihika, we supported her as the health sector because when she was coming in, she actually promised that she was going to ensure that she harmonizes the terms and that all health workers would actually be on permanent and pensionable. We are being told that the reason as to why they disengaged the officers who we are here today with, who are under contract, is because they wanted to abide by the law and ensure that they harmonize process and bring in the sanity. But those people who have been sent to replace them, there has been no advert. There has been no interview. They were simply disengaged, and people are appearing in hospitals that they have been engaged. They don't even have any paper to go and work there. We actually do not even know if they are officers, as we are being told, if they are qualified officers who are supposed to be working there. As unions, our stand still remains that any contract, whether hospital-based, whether county-based, is irregular. That you cannot be able to engage anybody on a short-term contract unless it's either an emergency or an expertise that is not there. And says we must abide by Section 45 of the Public Service Commission Act, which provides that if it's not a service with a time frame, and if that officer does not qualify for any other, that is the only time we are going to engage them on contract. So all the contracts being given, the ones that were there and the ones that the county government of Nakuru is giving today, are both irregular and illegal. And we have made that fact clear. The other thing is that the officers you are seeing here, while they were terminated, a number were brought back and the others were left. But the county is not able to explain why they decided to pick person A and leave person B. There is no criteria. We have inquired whether there were disciplinary issues with the people who have been terminated, and we have been told there was none. And so you wonder how people are brought in. But we know how people are brought in. It is on political basis. We know politicians have been sourcing for names, and those people are the people who have been put there to replace the others. And we cannot run health sector in this manner. That is why we have been saying we need to depoliticize the health sector. And that is why at some point we are saying if we can be able to get a commission that respects devolution, that will be able to survive in the setting of the devolution, probably that would be the solution. Because County A is doing this, County B is doing the other one, and now you can see the results. My brothers and sisters here who are aggrieved are being subjected to unfair labor relations simply because of politicization of the health sector, where people come in with their interests, they want to serve their interests, and they do not put the interests of the common mwananchi from Nakuru County before their own interest. So we have made our stand clear that unless you can tell us the criteria on how you have been able to delineate who you are going to retain and who you are going to dismiss, then that is discrimination as per Article 27 of the Constitution. Because our Constitution provides that nobody should be discriminated under any grounds. And if you cannot tell the criteria you use to retain some, then it means you are discriminating them, you are subjecting them to unfair process, and that is well also provided under the law. So I was sent here by the other unions to come and do a fact finding as we meet the county officials, and we have that information. And our role is to ensure that our members who we are with here today are not subjected to unfair labor relations. So as the unions, we will be writing to the governor demanding that everybody who was there is first reinstated, and number two, absorbed on PNP, because they have already been subjected to unfair labor relations in terms of being given contracts that are illegal, working for a long time under oppressive terms of engagement, and the fact that even when they were there was still a dire shortage of health workers. We are treating medics as if they are casuals, and what that means is that going forward, if we continue with these short-term contracts, we will not be able to take people back to become specialists. I can assure you, if this issue of contracts is going to take root, in 10 to 20 years, when the consultants that you know are going to retire, you will go to Tanzania or to Uganda to get a gynecologist, to get a surgeon, because there is no county that is going to take somebody back to specialize when your contract is 3 years, and your specialty requires more than 3 years for you to be able to specialize. So we must be able to strategize as a nation on where we want to go, that these workers have been subjected to unfair termination in the context of Employment Act, the Labor Relation, and even the Public Service Commission Act, and that even the contracts that are being given are irregular. And as the unions, we are going to take all the necessary measures to ensure that our members enjoy their rights, and we are not going to spare anything.
My name is Rose Master, Secretary Kenya National Union of Nurses, Nakuru branch. Tuangalie hao watu kama wazazi, because ya watoto, they have nowhere to go. Some are going into depression because sasa you find ulikuwa hii ndio tegemeo lako, umeamka one morning umeambiwa nao hauna kazi, enda nyumbani. Yes, we understand contract siko, but the way they are being conducted sio mzuri. Vile mtu anakaa anakupea salary yenye anataka, unakuta mwingine anapata 20,000 nasi mwingine ako girigiri anapata 15, mwingine so akukuwa na uniform, and yet you have the same qualification doing the same work na mnafanya, but kuna venye wame harmonize.
Mary Boniface, I'm the National Treasurer, Kenya Union of Clinical Officers. For healthcare systems to function, there are 6 pillars that must all work together for us to see results. And today, 2 of those pillars have been affected severely by what the county government of Nakuru has done. And these 2 pillars are the human resources for health and governance. We cannot talk of citizens being able to access healthcare when the service provider is not there. And those that are there are overworked, burned out, and extremely tired. So for how long are we going to look at healthcare as just another sector and not as serious as it's supposed to be for this nation to be able to move forward? So for this we say, and we ask the county government of Nakuru to look back and look at the people that they have laid down and get them to work and actually advertise for more, because there has been shortage even when they were working. So it can only get worse now that they have laid down people. We cannot continue to engage healthcare workers as cashiers. Today you ask them to come to work and then one day in an evening you send them home via WhatsApp message without any notice. This is someone who has worked for you for 5 years. They have suffered, they have gone through a lot, and then you don't look at all that. You don't even consider proper exit management. You just tell them go home.
We gave the 60 days so that we could go on the table and we couldn't interrupt the services. But the government seems not to care about the citizens. They don't care whether you are going to get the service or not. And they have decided we can go on strike, and I can assure them we know how to do it. And come 13th midnight, across the country, in all the facilities, there is no healthcare worker who is going to be there unless some magic happens and within the 7 days, we complete the CBS that we have and register. By 13th midnight, Kenyans will not be able to access the services because simply the government has decided to go on strike.